Welcome to Health System CIO's interview with Colonel Chani Cordero, CIO at Brooke Army Medical Center. I'm Anthony Guerra, founder and editor in chief. Chani, thanks for joining me today.
Hi, Anthony. Thank you for the invitation to join.
All right, excellent. You want to start off by telling me a little bit about your organization and your role?
Sure. Brooke Army Medical Center is part of the military health system, part of the Defense Health Agency. And we're a 425-bed licensed hospital where we serve level one trauma center, I should emphasize, where we serve the city of San Antonio. We're unique in that we are almost like the flagship hospital. I would say flagship hospital for the military health in a sense because we are the only level one trauma hospital in the inventory. Our our mission is unique because not only do we take care of our beneficiaries, which is around 500,000 here in the city of San Antonio and surrounding areas, but because of our world-renowned burn center, the trauma center, and other specialties like the Intrepid, that we also on occasion service the civilian community as well.
Okay, very good. So I wanted to chat a little bit about your telesitter program, which apparently is going quite well. So, why don't you just sort of jump in where you want there? Tell me, I'm always interested, especially in the relationship between operations and IT, and how IT professionals should and can stay plugged into operational challenges. Uh, even short of them bringing you problems, it's like, how do you stay plugged into what's going on so you can suggest solutions when they might not even think of IT as being a part of their solution? So you can talk about this particular program, and I am interested in sort of the genesis of this collaboration. Did they bring it to you? Did you bring it to them? Do you have certain meetings or governance committees where these kind of things are surfaced? And then again, with governance, it's all about prioritizing, right? You can hear about 15
Mhm.
different problems. You have to figure out which one as an IT department we're going to address. So I'll let you just jump in and we'll go from there.
Yeah, so in this particular, the telesitter was definitely a collaboration between nursing and the IT division, or my division. And so with this one, it was kind of a proof of concept. We have a problem, a challenge of limited resources when it comes to technicians and nursing, just like the rest of the industry. Everyone has a shortages, especially coming after the pandemic. You have folks that are burnt out. You have folks that are leaving the profession, and also because of the lucrative salaries for traveling nurses. You have teammates that are switching between a regular hospital system into that opportunity. And so with us, it's like, how do we best use our existing staff in a way that's more efficient, and also able to take care of the patient in the same way. And so that's where the telesitter program was born. We did a proof of concept. We purchased about 25 units, and we, put them in places that we felt that would be beneficial. And so, we had a meeting with a vendor about a month or so ago, and just pulling the reports and data from what we had been able to accomplish in a year was around 2,992 fall preventions, which of course is part of the national safety patient goals, part of the Joint Commission. And we also just had hundreds of thousands of cost avoidance in a sense of having to deal with any challenges or readmissions, or anything that comes with that. And if compared to having a one-on-one person that would observe a patient directly with this program, we saved around 60 FTEs just keeping, from that person, just from just having, one person watch one patient. So we're pretty excited about that. There's more opportunities. We're looking to see, could we maybe use this for elopement prevention? Maybe we use this, patient mobility has been very large. The literature is out there that shows, that having your patients mobile, helps with the healing process. And so, is there some opportunities to use this for patient mobility? And then, of course, the bed management. And so, our next steps in this is, we got some really candid feedback from nursing, far as in the actual hardware of this program, and maybe looking at shrinking that footprint, just because we have some space challenges. But also, is there some other service lines that will benefit from this? So this program is part of where, we were looking at the digital health, which was part of the strategy of the Defense Health Agency. And so we have expanded that, where your question was, is does, who comes with who, and it kind of, it depends. So one of the strategies that I brought to the team, was, how do we, implement our virtual nursing? And I learned that just from, trade shows, and some of my peer CIOs who, have those programs as well. And so I went to, one of our nursing leads, supervisors, and I asked whether there's an interest in this. And so I had a student, where this, officer went to, train with industries, a program that the military has, where we would select our best officers and they go work for a hospital system, and then they come back, for a year or so, and then they, bring back some of those ideas. So this officer was with me for a year, and he worked, with a hospital in San Antonio, and I gave him this as his project. And so, his name is, Major Tom Horrell, and he partnered up with the nursing leads that I mentioned, and they created our virtual nursing. And so with that, what we were able to do is we had some teammates that were part of our discharge lounge, and it was supposed to be a way where our patients who are, call them the walkie talkies, right? The ones who are able to, get up and move around, they can go to the discharge lounge and they would get discharged. We found that the program wasn't utilized very much. And so, was there a way to actually virtualize this and have the patients request it? And so, again, another proof of pilot, and we, implemented it earlier, last year, and that has also saw really great success. The lounge is being used a lot more, or excuse me, because of the virtual aspect of it, the patient is able to be discharged from their bed. It saves it saves the inpatient nursing time and resources, because those patients are being discharged with another team, allowing for those nursing personnel to maybe focus on other tasks, or maybe there are other patients. And so it's a win-win for everyone. And so, all of this, of course, we do have a governance structure here. We, of course, just like everyone else, I have a budget and limited resources. And how do we prioritize? And so, we're very similar to every other private hospital, where we look at what is our strategic plan, and what is our goals for that year. And then, do we have initiatives that support that goal? When it comes to actually how do we onboard and decide applications or software or just systems or whatnot, I have, my governance board is we call it the TART, the technical assessment readiness tool, which essentially is we bring, our engineers and our cyber, along with the customer, and we go through a questionnaire to ensure that, we are first asking the question, what problem are we trying to solve? What is it we're trying to do? And then, do we have the resources in house? Do we already have, a similar application? Or if this is something new, we go through, this questionnaire to ensure that it's something that we're able to bring into our organization.
All right, excellent. So if I caught you correctly, for this specific the telesitter idea, this is something that you had come across in going to conferences and collaborating with your peers and staying educated on what other people are doing, you'd heard about this. You went to nursing and said, here's something that and I'm putting words in your mouth and you can clear it up for me, but
Mhm,
here's something that other folks are doing and people are saying it's effective. Is this something that would help you? Is this something you need? And you received a positive response. Yes, this is something we need. You could just
mhm,
have easily have received a response, something like, no, we're good, right? I don't have particular need in that area. And then you move on. But the general idea is to stay informed and educated about what your colleagues are doing that they're claiming to have success with and bring those
mhm.
things proactively to your users, correct?
That's correct.
All right. Anything more you want to add on that sort of dynamic?
No, I mean, that's why the trade shows and the conferences and things like that are so important because it gives you an idea of what's out there and and what's the possibility, the realm of possibility. And then, when you with in the involved with the professional organizations, you get to be with your peers and then you find out if is this application or is this vendor you know do they do what they say they're going to do? Do you see the results? Some organizations are early adopters and kind of in the fail fast mode. I would say that our organization is more cautious because again we do have limited resources, but even more so, our we have a lot of cyber challenges that we have to ensure that we meet. And so um, partnering up with similar folks will allow you to maybe vet some of that technology.
Yeah, absolutely. A fast follower, right? We're not going to be the trailblazer, but you be the trailblazer and let me know how it goes, right?
Right.
That works. That works. That's great. So it's the idea of that's sort of the dynamic of proactively bringing suggestions to operations. And then there's the other dynamic, which again, in that mock conversation I gave you, one of your users could say, no, we don't have a particular need for that, but here's what I do need. And in that
Hmm.
case, then you go off and do your research, try and work it in a governance plan, see if it's going to bubble up based on, I guess, the priorities of the organization. You mentioned, what's the mandate from on high? What do they want us focusing on? And therefore, and then we want our projects to support those pillars or those
Hmm.
strategies, right? So and I
That's
guess
correct.
that's how you do it, right? So if a request comes up and then you compare it against the sort of strategic imperatives and it doesn't line up, that's gonna drop lower down. It's gonna go to the bottom. So do
That's
I have that
correct.
right? Tell me about that.
Yeah, no, no, that's absolutely correct. And so, a lot of times, especially early in my career, everyone's like, what's your IT strategic plan? And over the years, I don't have an IT strategic plan. My organization has a plan. And if there is an area that I really feel strongly about, then, we have an offsite. And, when I'm able to voice that through my leadership channels to say, like, this is an area that we have an opportunity with, and it becomes the organization's strategic plan. And so after that, then I have my own action plan to implement the projects that supports the strategic plan. And so for example, years ago we had a strategic plan about enhancing communications, and so my action plan was actually really looking at our infrastructure and seeing where are the challenges that was going to keep us from hitting our goal of enhancing our communication. And so, creating this plan, was able to get, our version of the OPEX funds and CAPEX funds to be able to implement just something as simple as a distributed antenna system, being able to have cellular access throughout the whole organization. And it sounds so simple, but before you build tools that rely on certain capabilities, you got to build the infrastructure to support it. And so, you got to look out and say, well, then are we healthy enough to be able to bring in 5G capable devices, for
Mhm,
example?
mhm,
Well, we have to make sure that we have the infrastructure to support that. And that is part of that action plan.
mhm. Very good. All right. Um, some of the hardest stuff in your job and people who have your job isn't the technology, it's dealing with the users, the people, and managing
Mhm,
expectations, right? So
mhm,
there's a
mhm,
couple dynamics I'd like you to touch on. One is the concept of providing project transparency. So you're working on something that some users want or department wants. Um, what are your thoughts around the importance of letting them have transparency around timing? So it maybe
mhm,
taking a little longer. Maybe there's some hiccups that have come up. Maybe the vendor
mhm,
that you thought you were going to go down the road with when you're doing your evaluation, they have cyber problems that they need to solve. So things are going to
mhm,
move slower. So how do you manage that? Because if you don't do that, you're gonna get people unhappy with IT, right? IT
mhm,
where
mhm,
projects go to die. Nothing happens with IT. It's been
mhm,
sitting there for 6 months. How do you avoid that?
No, I really like that question because we're busy. Everybody's busy, right? And when when our customers and departments and clinicians have projects, they want them now, right?
Yeah.
And that's understandable. And so when I first got here, I mean, I had a projects team, but not we didn't at the time do a really good job of capturing all of the different projects that we had going on.
Mhm,
And so, especially some of the smaller, like little one off projects, little pet projects or whatnot, we weren't really capturing that. And so, um, I started revamped our project team and we made sure that we capture all our projects that someone is working on, from networking, from our sysadmins, from our informatics team. And so so that project team, captures our projects. On top of that, just to your point about transparency, sometime our teammates didn't understand, our customers didn't understand the amount of people it might take to do a certain project. And so when I first arrived at our hospital a couple of years ago, we were in the middle of our EHR implementation and also two other very large projects at the same time. And so what I had to show and demonstrate is the resources that are attached to different projects and the availability that we have at certain times, just a simple Gantt chart. And so all of my chiefs, my direct reports, what they did is we had basically a chart and it showed the resources that are tied to certain projects at a time. So it might be like, 30% of the networking team, 30% of the system admin, and 20% of the engineers. And so we were able to show, what's our work in progress. And
mhm.
so I think that helped paint a picture to our users to let them know that we want to address these projects and we want to address them in a timely fashion, but these are the tasks that we're working on currently. And so I think that helped with the understanding, the transparency, and then also letting them know where my resources are, or how my resources are tied up.
Yeah, it seems to me like such a key to success in your role. I mean, as you said, you have to define the capability of the department in terms of personnel, budget, and whatnot. So here's what we are capable of based on our size. That
mhm,
would be different if we were 30% larger as a department.
mhm,
So, but here's sort of what we can do. Here's what we're working on. And that's the importance of, as you said, capturing everything you're doing. Because if you're doing a whole bunch of stuff that's not sort of being accounted for, or you're not getting credit for, then it looks like
mhm.
you're underperforming, right, as a
Correct,
department. So
correct.
you define the capabilities, you make sure you accurately capture all the work being done, you make sure that the work is in line with the strategic goals, and
Mhm.
then you have a story to tell people if their project isn't going to be tackled right now, here's why,
Yeah.
or if their
Right.
project's taking longer than they want, here's why, right? It's
Mhm.
transparency with the users. They may not love it, but at least they should understand it. But if they're
Right.
in the dark on that, that's when IT gets a bad name. And if that
Yeah.
doesn't get explained to the proper people, they could just think IIT is not doing a good job, right? And you don't want that.
Yeah. Right. And it helps because if, again, I don't expect my users to understand IT, right? And I don't want to expect them to, understand some of the cyber challenges or things that, that we have to work on. But when they do, if they are upset and they go through their leadership, that goes through my leadership,
Yeah, right.
and it, kind of bubbles up, then if there is a time that we need to reprioritize, then that's okay because the
Okay.
organization is saying that this takes precedent over some of these other ones. And so, we welcome the feedback because, again, our goal is to take care of our patients. And so, if there's a project that might reach that goal and that falls along with our strategy, then it's okay to do that reshuffle.
Right. That's excellent. And I understand you are work pretty closely with your CMIO. Do you want to talk a
Mhm.
little bit about the benefits and the importance of that relationship and how it has helped you? I mean, we have different types of CIOs these days. A lot of clinicians are take in the CIO realm, not MDs. To them,
Mhm.
a CMIO may not be as critical, that relationship, but certainly to someone who sort of comes out through technology, having a bridge to the clinicians could be quite helpful. Um, what are your thoughts?
So, over 20 years, I've seen the different models between the CIO and CMIO slash CNIO,
Uh-huh.
and now sometimes even the CHIO,
Yeah. Oh,
right?
yeah. Yeah.
And what I found to be successful for me, and it can somewhat can be an emotionally charged topic depending where you're at, because it's like who works for who, and
Uh-huh.
sometimes it matters, sometimes it doesn't. It just depends on the relationships of that hospital and the way in the way that hospital is organized. So for me, the CMIO and the CNIO falls under the IT department. And some organizations, they have focused the CMIO just strictly on the electronic health record, and I think that's a mistake.
Mhm.
There's a lots of opportunities to optimize the electronic health record, but there's so much more that the CMIO can do. And so my CMIO, her name is Lieutenant Colonel Victoria Sullivan. She is a rheumatologist by trade, and she is absolutely our bridge, not only just with the electronic health record, but all of these other applications that
Mhm.
we have and projects that work in a clinical environment. For example, the Telesitter program, she presented our report data to they call it, let me see, it's called the let me think what it stands for. It's a it's a committee that has a lot of the department chiefs, clinical department chiefs, in it, and she supported it. And then she was able to, as a rheumatologist herself, a lot of her patients may not be, the exact right um, type to do the telesitter program, but some of the other specialties are. And so just talking to them about, instead of prescribing or asking requesting a one-on-one, can this patient be stepped down into our telesitter, freeing up that those resources for someone who's a lot more complicated and need that one-on-one. And so being able to talk to them and say like, hey, internal medicine, or maybe not the ICU, of course, but critical care or whatnot. But some of these step down units, is this an opportunity, so that we can save resources elsewhere?
Perfect. Let's touch on the idea of return on investment. And you mentioned that in some things you've written that initiatives have to pay for themselves. Sort of, there has to be an ROI and that type of thing. Tell me about that dynamic, and any advice you have for your colleagues when it comes to that type of thing.
Especially, right now with resources being constrained all over healthcare, when we're implementing something, again, it's like what problem we're trying to solve. And, how you measure it is lots of ways and lots of opportunities. The telesitter program, in a sense, it saves 62 FTEs. I mean, if you want to do the math of, how many people that is, I mean, that program absolutely paid for itself. But, in other initiatives, the you, you may not be able to see a monetary ROI, but it doesn't mean you won't see an ROI in other areas, the soft skills, so to speak, and the patient experience. And but it is important to not sell sunshines and rainbows and unicorn, but actually say, this, you know, implementing something like this is going to help, again, in those maybe HCAP scores, or, whatever patient survey that the organization uses. I mean, I could tell you that, I implemented um, a patient forward help desk. This is for our portal, our EHR portal. Because being part of the DoD, we have some unique challenges when it comes to identity management, and so sometimes it was very difficult for our patients to access our portal. And so I saw a need for this when I sat. We have what we call a retirement appreciation day, and I sat and I represented the patient portal. And I had, patients coming to me saying that they haven't been able to get into their portal in 3 years since
Oh
we
boy.
launched our EHR. And so I had spoke to my team about it. Well, we didn't really have the resources to, buy or provide a new FTE. But instead, I canvassed, my team, my informatics team, and my help desk team, and see whether there were any volunteers, and if they had time to do it within their workday. And so we set up a limited hour structure. And we had, one of our informatics teams that volunteered to like lead the effort. And I mean, now, I mean, he sees anywhere from 20, sometimes as many like 40 patients a day that are
Mm,
just asking for help. And they're just asking how to navigate, our portal. How do they get into the portal? And there was things that we found that we didn't know that could be an issue, right? We're all kind of like IT centric. And so, being able to, like our system, you need one email address. Well, there's a lot of, couples that share email addresses. And so they, just something as simple as that that says, oh, you can't do that. You have to have your, unique ones.
mhm,
We were able to build that. But you say, what's the cost of that? Well, again, part of the problem that we were trying to solve is that we had a very low utilization rate of our patient portal, especially when it comes to, making appointments. Well, we have a centralized call center, and part of the complaints is how long people have to stay on the phone, in the queue to be
mhm,
able to get through to speak to an agent. And so, by pushing the patient portal utilization, then we can take some of that burden from the call center, and that helps with the patient experience. So,
mhm.
for those who just want to be able to talk to a person, they don't have to be in queue for 10 minutes. And for those who don't have the time to talk to a person because, the hours are, maybe 9 hours a day, and it's 6 o'clock at night, and they want to make an appointment, they're able to do so without having to call somebody.
Excellent. All right. We're almost out of time, Johnny. I want to ask you one more
Mhm.
question, and then I'll let you go. You mentioned burnout earlier in the call. Where are we, do you think, with that? Among clinicians. And we know that there's going to be plenty of issues that have nothing to do with IT that are causing burnout, right? There's plenty of stuff on the
Mhm.
payer, dealing with payers and prior auth
Mhm.
and
Mhm.
all kinds of stuff, hours worked, whatever, that have nothing to do with IT. But there could certainly be some things that have to do with IT that cause frustration. Where are we with that? Do you think we're in a better place than we were a few years ago? Or do you think there's still a lot of work to be done? And how much of a concern is that to you, in your work?
I think we're still going to have a lot of work to be done because of the rate of change for technology, and
Mhm,
in the way it impacts clinicians. It is, with like Moore's law, right? That technology is exponential, and there's never going to be a day where our patients, or excuse me, our clinical teams are able to just grab a notepad and and document that way, right? They're going to have to do a touch point. When I teach I actually do a day of a physician, and I ask my students to um, count the touch point that technology touches a provider, anywhere from badge access to the parking garage, and to the phones and the applications and things of that nature. And so what I my concerns when it comes to our clinician partners is that we are continuing to introduce more application, more software to their workloads and to their workflows, I should say. And that means learning something new again and again and again. And
Right.
so what IBAS can do, I feel like to do is that expectation management to actually tell them to say, hey, listen, like I'm about to implement this application. You're not going to go home earlier today.
Uh-huh.
You are not going to have all this extra time. But maybe you can have lunch today, or you're able to do your documentation or whatever this application supposed to help with the efficiency, and you're able to go to your kid's soccer game tonight.
Mhm. Mhm.
That's the goal.
Right.
Um, but I think sometimes, and it's not necessarily the IT team, it's the industry partners. We oversell how wonderful and great this application is going to be to their lives. And then they're just frustrated
Yeah.
because it's not that sunshines and rainbows that you promised them. And
Right.
so I think, in order to be um, partners in this, is that we have to tell them what to expect.
That's great. Transparency and everything, right? Set expectations and
Mhm.
be transparent. Johnny, I want to thank you so much. This was a great interview. I really appreciate your time and look forward to chatting with you again down the road. Thank you so
No,
much.
same. Yeah, no, Anthony, thank you for allowing us to tell our story. I really love sharing the military medicine story.
Have a great day. Thank you.
Thank you. Bye bye.